My name is Dr. Jason Jensen. I am an interventional pain physician at Arizona Pain. I wanted to talk to you a little bit today about a new and exciting procedure that we're offering at Arizona Pain called the Intracept procedure. This is a minimally invasive procedure that can be done at an ambulatory surgery center. It requires the patient to have an anesthetic, and it's typically a procedure that can be performed in about 15 to 30 minutes. Patients go home the same day. There is very little post-operative recovery time, and typically the time spent at the surgery center will be about an hour. The procedure is performed by making a very small 3mm incision in the lumbar spine. We then access your vertebral bodies through a small cannula, and through that cannula we put a probe, and that probe is designed to heat the nerve that is causing all the pain from the inflammation in your back. That nerve is called the basivertebral nerve, and we know that if we can heat that nerve and knock it out essentially, and we can stop that nerve from transmitting pain signals to the brain, and over the course of several weeks, patients get excellent pain relief. Patients that are an excellent candidate for this procedure are those that have been experiencing chronic low back pain, non-radiating, for a period of at least 6 months or greater. They've tried and failed other forms of conservative therapy such as chiropractic care, physical therapy. Maybe they've had trigger point injections or medial branch blocks and an ablation of their lumbar spine, and they're still experiencing chronic low back pain. Patients would require an MRI of their lumbar spine, and what we're looking for is changes of the vertebral bodies called modic changes. And modic changes basically is a fancy word for inflammation of your vertebrae. And what we know is that if we can knock out the nerve supply to the vertebrae, which is a nerve called the basivertebral nerve, we know that we can stop the vertebrae from transmitting pain to the brain. The recovery time for this procedure is very minimal. Obviously, patients are told to take it easy the day of the procedure. They have an anesthetic, so they can't drive that day. But the recovery time is usually within 24 to 48 hours. Patients will start to experience pain relief over the next 2 to 3 weeks, as it takes time for some of these changes to take place. Patients may or may not even require any post-operative pain medication. The wonderful thing about this procedure is when we looked at 5-year studies, those patients that had this procedure and then they looked 5 years later were still able to maintain significant pain relief, greater than 50%, even after 5 years. It's a very safe procedure. Post-operative pain is very minimal. So if you're watching this and you are experiencing some of these symptoms such as chronic low back pain, and you've tried physical therapy, and you've done radiofrequency ablation, and you've done chiropractic care, and you're still not getting the pain relief you want, come into Arizona Pain. We'd love to evaluate you. We'd love to be able to take care of you and offer you this procedure if you're a good candidate.